we? Okay, so welcome everybody. Good evening. And this is the final edition of the Note to Prevent speaker series for the 24-25 year. We're looking to continue the program next year, so stay tuned. Information should be posted on our website, www.notetoprevent.org, as you see on the bottom. For those of you joining us for the first time, Note to Prevent is a collaborative of agencies and coalitions within Westchester working together to provide parents with the tools necessary to increase resilience and to reduce risky behaviors among our young people. For more information about us and also to access the recordings that we have done for several years now, for most of our presentations, you can visit notetoprevent.org as noted. Before we get started, a couple of housekeeping items. One, tonight's presentation is being recorded, and everyone will receive a link to the recording along with a handout called the tip jar, which stands for takeaways, information, and prompts, and we'll highlight all of the information tonight from our speakers for you to have as a reference. There will also be a Q&A session following the presentation, so we encourage you to type in any questions you may have into the Q&A box, which will be answered at the end. And as is the tradition with this, we always feature one of the highlights of, or one of the sponsors of the collaborative. It is my pleasure. My name is Lisa Tomini to introduce, as the coordinator, the Scarsdale Action for Youth. We are a local Scarsdale-based coalition dedicated to empowering youth and their families with knowledge and skills to build resilience and for families to make informed decisions. It's my pleasure to introduce tonight's speaker. We're lucky enough to have 3 of them, and I will let Nancy go ahead and do the honors.
Awesome. Thanks so much. Thanks, Lisa, and thanks to my colleagues. I'm Nancy Pasquale. I am the coalition coordinator of RIACT here in Westchester County. So, and RIACT is also a sponsor of the Know to Prevent and a part of the Know to Prevent collaborative. So it's my pleasure to introduce my colleagues from the Institute for Behavior and Health and the One Choice Prevention, One Choice community. First, I'd like to introduce Dr. Caroline DuPont, who is the Vice President of the Institute for Behavior and Health. And One Choice Prevention is an initiative of the Institute for Behavior and Health. Dr. DuPont is a clinical psychiatrist, and her area of expertise is in addiction and anxiety disorders. I'd also like to introduce another colleague from our One Choice Prevention family, and that is Debbie Burnt, who is the director of the Parent Movement 2.0. She is also the host of SAMHSA's Talk They Hear You campaign podcast. So I'm thrilled to have them here with me today for this presentation. And we're going to get started today. Debbie, if you could forward us right along. We're going to get started today because it's April and it's spring, and spring is spring. And if you're a parent of young people, spring is a thing. And we know that spring is a time that brings with it lots of excitement, lots of activity. And that can be both exciting and stress producing, right? Lots of young people are thinking, and their families are thinking about what's getting ready to happen next year. Perhaps you have a child who's moving in a significant way from perhaps elementary to middle school, or middle school to high school, or high school to college, or work life and beyond. And there are also a lot of events and activities that take place around this time that are associated with increases in substance use for young people, right? So we know that those transition times we see in our student use data, that often times of transition can be associated with increases in substance use. And also those celebrations and that stressful time of final exams and all of those things can also be a time when young people are feeling extra stress that can also be associated with increases in substance use. We know, for example, that substance use and mental health challenges are closely connected. So these are all essential, important parts of conversations around health and wellness right now. This is why this particular moment is a perfect moment for parents and other caring adults with children, with young people in their lives, to sort of reconnect and recommit to having those prevention conversations. So we're going to start that thought with trying to contemplate what the goal of substance use prevention is for young people. And the goal that we define at One Choice is no use of alcohol, nicotine, marijuana or THC, or other drugs by youth under the age of 21 for reasons of health. And I know that's really a mouthful, but part of why we share it in this way is because it's really important to make sure that we're very, very clear about what that goal is and why. And that goal is analogous to other health standards, right? It is what we call a health standard. And we think of that like we like to think of it in the same way we think about things like wearing seatbelts, things like bicycle helmets and eating healthy foods and exercising. So even if you're concerned because you're not sure if your own child or a child that you know falls in the category of never having used anything before, this is still a really important message and standard to establish for them, because it's one that's related to health. And we're going to talk a lot about that going forward. So even if we know we know it's not a purity standard, right? It's about health. The other thing that I think is important to point out here is that often parents struggle with this idea when they think about their own use and their own youth. And what's important to understand is that when we know better, we can do better. There's lots of science that has advanced and evolved since the time that many of us as parents and caregivers were young people. And it gives us new and exciting information that helps us have these conversations with clarity, because we know more information than our parents knew when we were teens, right? So a really important point to bring out. So we've actually developed a tool that we're going to be sharing with you tonight, and it's a digital tool that is available to you. And it's called the One Choice 5 Prevention Framework. And the One Choice community is comprised of coalitions and groups. There are more than 80 different coalitions and organizations and groups from more than 30 states across the country that come together periodically to work in this space together to talk about how we can share this goal in meaningful ways and do this work together in our communities. A small working group of that group that included Debbie and myself and Dr. DuPont. It also included, for those of you from Westchester here, our colleague from Ossining, Alice Joslow. A group of us from multiple states across the country got together to create the One Choice 5 prevention tool. And the One Choice 5 is comprised of 5 basic steps or key ideas that we think every parent needs to know or every adult needs to know about youth substance use prevention. And you can see them here. They are: knowing that substance use is not inevitable, being brain development savvy, being substance savvy, talking early and often, and acting quickly if you suspect substance use. And we frame all of that in a foundation that makes youth substance use prevention a health priority. I'm going to turn it over now to Caroline, who's going to get us started with youth substance use is not inevitable.
Thanks, Nancy. Yes, I get to take over when we get to the exciting data. So if you're not used to thinking of data as exciting, I'm hoping that you're going to think about this data as exciting. All right. So as Nancy said, our first point is that youth substance use is not inevitable. Substance use is not a normal part of teen development, and it's not something that we should think of as just the expectation of youth to experiment with substance use. And when we say that, people sometimes are like, well, but that's not realistic. People really do. Teens use a lot of substances. It's normal. And this graph is going to show us how it's really changed over 40 years. So this graph is monitoring the future data. That is big national data. But we at the Institute of Behavior and Health asked a different question of the data. And instead of saying, what percentage of this grade, like high school seniors, use alcohol, or what percentage use marijuana, we said, how good can it be? What percentage of high school seniors don't use any substances? So again, high school seniors, no use of any alcohol, cigarettes, marijuana, or other illicit drugs, none. And we looked at the data that started back in the 1976 and then all the way up to basically pretty much the present time. And what you see is that there's a really clear slope on both of these lines. So we're going to look at the bottom line first. So the bottom line is lifetime not use. So these are high school seniors who have never used any of the substances in their lifetime. And you can see back in the 80s, it was about 3%. About 3% of high school seniors had not used any substances. But if you look now, we're up at 36.5%. That's like a showstopper. That's more than a third of high school seniors have never in their lifetime used a substance. And it's such a huge change, but a steady change over time. And that's really exciting to me because, again, as Nancy says, we're talking about for health. But we're talking about a health standard, not a purity test. And so the purple line, in a lot of ways, is even more important and more exciting. The purple line is past month non-use. So these are high school seniors that said, I haven't used any of those substances in the past month. And you can see, again, back in the 80s and 90s, somewhere in that 16-20% range of high school seniors that I didn't use in the past month. And now 63.9%, almost 64% of high school seniors haven't used any substances in the past month. And that is really exciting about the teens taking the active decision to choose their health and to make smart choices for themselves.
So one thing I just want to jump in really quickly, because I'm sure that there are folks who are wondering whether this national data, how this national data set compares to information up here in Westchester County. So I will share that that both aggregate Westchester County data and in sharing information with colleagues from like Lisa and others from across Westchester County, this growing trend of non-use and the idea of non-use among youth and that most teens are not using is actually consistent here in Westchester County as well. So that is consistent with this national data trend also tracks for our Westchester County trends, that there is a growing number of young people not using substances, which is great news to know and super exciting. Caroline's going to share a little bit more, dig a little deeper into that.
And I think one of the things that I really like to point out is that often the adults are surprised by this. And I think it's honestly because the adults were in school during that time that it really was different. But also the people who are non-users often fly under the radar. And so they're not talking a lot. So today's students who are non-users often don't talk about it a lot. And so you don't realize they're there unless you ask. But when we have the opportunity, not only to talk to them about it, but to even give them the microphone, to give them the platform, they always have really strong reasons why they're in this category. And that's why I called it an active choice. These are not just people that just haven't used. They've made a choice not to use. And this is very exciting. So this is a little bit more of a common use of the monitoring in the future data, where you're seeing it broken down by different substances, and you're seeing use instead of non-use. But I want to show over this longitudinal period of time, again, from the mid-70s to the present time, how much things have changed. And I'm thinking about this in a lot of ways, is this is encouragement to all of you who are in here with us fighting the good fight, who are really working on public policy, on prevention in schools. And this is to show that what work we do really works. So if you look at that alcohol line, look at how much that's come down over that 40 years in terms of past month high school alcohol use. It's really quite dramatic. And that has to do with all sorts of things. You see at the top, we've talked about the parents' movement. That was a really powerful nationwide movement by parents who were very concerned about both alcohol and marijuana use at the time. And you can see both alcohol and marijuana really are affected during that time. And then you also know that there's the big changes in the 90s, for example, with the increase of the drinking age. And that's big public policy that frankly was brought on because the nation was concerned about substance use and alcohol use, particularly among youth. You can see when the marijuana legalization movement got going, when they big business of marijuana took over, that marijuana was way down, and it's been creeping up since then. And we'll obviously be talking more about that today. And we also did add in vaping because you can see that cigarettes really came down after the tobacco settlement came about, and the Truth Campaign, the Truth Initiative is just really powerful in terms of getting that cigarette use down. But vaping came in as a new delivery method. And it's one of the reasons that we are always thinking about all substances, not just substance specific. I want to just bring this up just briefly because that data that I showed you is that top line, 12th graders. That's that first graph I showed you. And that's very exciting, but I don't want to forget our younger students. And look at these great numbers for lifetime non-use. So like those 8th graders, which are circled. So 70% of 8th graders have never used any substances. And almost 90% of them haven't used in the past month. This is really exciting information. And again, if you don't ask for this, if you don't look for it, you might miss this. Look at those 10th graders. 54% of 10th graders haven't ever used marijuana, haven't ever used any marijuana, alcohol, or nicotine, or vaping, or anything. That is really good news. Okay, so the second that we're going through, as Nancy said, these different points. And the second one is to be brain development savvy. This has to do with knowing what the science is, okay? And so we're going to talk a little bit about science. I liked data, and now I'm going to like science. So stick with me here. One of the things you have to know when you're talking about prevention is, what are you trying to prevent? And one of the main things we're trying to prevent is the onset of substance use disorder. And substance use disorder is a pediatric onset disease. We don't usually think about it that way. We usually think about that as an adult disease. But in fact, 90% of people with substance use disorders began their use before the age of 18. And unfortunately, we know that many of them start significantly before the age of 18. And the earlier and the heavier that use is, the more likely they are to go on to develop a substance use disorder. And then I want to just point out that substance use, early particular substance use, also increases the risk for a variety of other adverse health outcomes and other types of outcomes, like decreased graduation rates, for example. So this is actually, I just think this is a really scary slide. You know, I was talking about this is a really great slide. This is a really cheerful slide. This is a scary slide to me. This comes from Partnership to End Addiction, and they show that use before the age of 18, there's a 1 in 4 chance of developing addiction or a substance use disorder. 25% of people who initiate their use of substances before the age of 18 will develop a substance use disorder. But if that initiation of substances is after the age of 21, it's only a 1 in 25 chance of developing an addiction or substance use disorder. That's wow, that's a major difference. So I want to point out that, of course, it's not like everybody who uses substances is going to go on and have a substance use disorder. We all know that's not true. But this has to do with risk. And this is a pretty significant difference with that early exposure having such a higher rate of going on to have a substance use disorder. And it's not for no reason, it's because of brain development. It really is. It has to do with the fact that that brain under the age of 25 is still developing. And it's got a lot of growth to go during those teen years, those adolescent years. So this on this graph, which is just so pretty, I think it's so lovely, it really shows that the only parts on this brain that are fully developed are the deep purple parts of the brain. The brain kind of develops from back to front, and it starts with kind of motor things, and it ends with judgment and things like all the kind of executive functioning things. And so anything that can happen to this brain during those years of development can actually change how that brain develops and what that brain, how that brain learns to prioritize things in terms of even happiness. What are things that bring you happiness or pleasure? And so brain protection is something that we take really seriously now. And Nancy said that, like, when you know better, you can do better. When I was a kid, no one worried about concussions. Now schools all have concussion protocols. When I was a kid, we didn't know that drugs could literally change the development of your brain. We now know that. And so, again, we know better, we can do better. This is such a wonderful slide that Debbie has introduced me to. This slide is really just bringing home the idea of the neural pruning and myelination that goes on in our brains. Little kids' brains are just all the possibilities are there. And then as that brain develops, the brain learns to kind of focus on what works and what's powerful and what's good for the brain, and prune out the things that are not necessary. But that means you have to be careful about what you're teaching that brain. And so you want to make sure that the things that are getting optimized and hardwired in your brain are the things that are going to be positive for your health.
To the biological aspects of addiction, there's also, we have to acknowledge a social aspect of addiction as well. And this study, or the information shared here, is from a study that talks about substance use disorder as in terms of communicable disease. It's often spread from one person to another, and by that what we mean is in social situations, often a young person who has not used substances before is introduced to that by someone who is already using substances. And what's important to note here is that it's often not malicious. It's often even perceived with good intention. Either, hey, this is helpful, or this is fun. Do you want to try? For example, and again, thinking back to this time of year and this time of stress for kids, hey, are you cramming for a test? Try my ADHD medication. It really helps me focus. Right? This is one way that substance use can sometimes spread from a person who uses a substance already, sometimes not even in an illegal way or in a harmful way, to someone who doesn't. Or, hey, if you're feeling stressed out, when I use marijuana, it really helps me. So it's often perceived by the person who is sharing it as helpful or fun, and not necessarily as harmful. However, what we have to remember is that initiation often doesn't, no, we're still back there, Debbie. Initiation often doesn't have harmful effects. No, we're one back still. Doesn't often have harmful effects initially. Often those negative effects are not seen until over time. Although it is important to note in today's environment that things like fentanyl and high potency THC, and some of the very, very high potency drugs that are out there. And we're going to talk more about those and what those look like. So don't worry. Are changing that conversation as well. It's important to acknowledge that. But often young people don't see the consequence of or negative consequences associated with use right away. And it's also important to remember, speaking to that idea of that hardwiring and that myelination and pruning that's happening, all people, adults, young people, when people use drugs, they use them because they work. They have an impact on the brain reward system that is much more intense and powerful than natural rewards, like getting a hug from a friend or a smile from that person that you have a crush on, or the food that you like the best. Drugs super stimulate that brain reward system in ways that can, in fact, impact that pruning and myelination process that's happening in brain development at this time for adolescents. The other thing that we know is that teen substance use and perception of peer use go together. So teens are likely to choose friends who use substances in a similar way. So thinking about that and knowing and asking questions when you're having conversations with your kids is an important part. Understanding what's going on with their friends, talking to them about what their friends are doing, what they're thinking about, what they're talking about, and that friends influence one another's substance use over time. Right. So a Steinberg study shows that the degree to which an adolescent's peers use alcohol or illicit drugs is one of the strongest, if not the single strongest predictor of that adolescent's own substance use. And some of that is just access and availability, right? It's in front of you. The more times it's in front of you, the more often, the more frequently, there are just more opportunities to make that decision to try. So having those conversations about steering clear of places where substance use is happening is important. The other thing that we know is that in addition to youth influencing one another's behavior in a negative or risky way, the inverse can also be true, right? Young people who are not using substances can also be an influence on their peers, which is one of the reasons why we spend a lot of time now, those of us who work directly with youth, really talking about being open and honest about their own non-use, because that can be an offer and an invitation to a different opportunity for a friend or a peer. The other thing that is an important thing to note in this in our new environment is that social media is what Dr. David Jernigan calls a super peer, right? So back when we were teenagers as parents, we didn't have thousands of peers in our pocket in a supercomputer every day, all the time. And Dr. Jernigan's study showed that greater exposure to substance-related media can increase normative beliefs about pure alcohol use, right? So it makes teens think young people that their friends are using, even if their friends around them are not using at very high rates. And this can be predictive of greater alcohol use, for example, in his study in adolescents. And then the last important sort of brain savvy piece that we want to talk to you about is, of course, that connection between substance use and mental health. And we know that the use of alcohol, cannabis, and nicotine are each associated with increased prevalence of suicidal thoughts, as well as depression, anxiety symptoms, psychotic experiences, and ADHD symptoms. So we like to frame that there is no problem so bad that alcohol and other drugs can't make it worse for young people. And further to this point, when we look at marijuana specifically, this study, which again analyzed data from the National Survey on Drug Use and Health, analyzed data of youth ages 12 to 17, an enormous, more than 60,000 young people in this study. And this analysis was done and separated those young people into 3 groups with relation to their cannabis use. One was no use in the past year, one was use in the past year, and one was cannabis use at a level of cannabis use disorder. And what you can see here is that the group that had the lowest incidence of major depression and suicidal ideation are those with no cannabis use, and that even those with a cannabis use disorder, an actual disorder diagnosed, had the highest rates. But even those teens who did not have, who did not rise to the level of a diagnosis, still had increased higher prevalence of depression and suicidal thoughts than those who did not use. So these are very important for us as parents, as we contemplate, and caregivers, as we contemplate what's going on right now with mental health with our young people, to keep in mind as it relates to substance use.
So let's talk about some of those substances for a second. There are so many forms and potencies across the entire drug landscape, and that landscape keeps growing. In fact, we're seeing really what I think Dr. Bob DuPont coined, which is a commercialized recreational pharmacology element to our society. And what that means is we have massive industries: alcohol, marijuana, nicotine, probably psychedelics here soon, and then lots of illicit actors that are driving product development and sales. And their products are greatest from their heaviest users. And these drugs super stimulate the brain reward system, which supercharges repeat use, which is what creates the heavy users. And heavy users end up being customers for life. So potency and potentially vulnerable users equal the commercial goal in our addiction for profit industries. And youth happen to be the most vulnerable user population out there. We end up seeing a lot of excessive targeting in our economically disadvantaged and minority populations as well. So what is out there? Let's just start looking at marijuana. Oh, clicker is going crazy. That plant form of marijuana that all of us who might be a little bit older, may be used to, is still out there. It's called flower or herb sometimes. But the key to marijuana is, if we had smoked a joint as recently as the 1990s, we would have consumed about 3% THC. Today, there is no plant form marijuana on the market less than 18% THC. Most of it's in the mid-20s. So at baseline, if we have a kid who's using, they are consuming something that's 6 times stronger than anything we would have used. Then with all of this commercialization, we have an industry that's learned how to take the THC out of the marijuana plant, and that's the cannabinoid that makes a person high, and get rid of that plant body. And we're left with liquid and solid concentrates. Solid concentrates are all kinds of solidish forms: glass looking, oily, crumbly. They'll be called shatter or butter or wax. They're really sometimes crack. They are burned with some kind of fire tool, and the smoke that comes off of that is what's inhaled. The liquid concentrates are what are vaped. This is the PAX system, which is one of the common marijuana vaping systems. And if you look at that, if their little pod, it boasts 85% THC. So these products, both liquid and solid concentrates, are almost 100% pure, really, really strong. Those concentrates are then added to foods and drinks, and it's created this entire class of products called edibles. And you'll see all kinds of products with goofy names: Pot Tarts, Fruit Puffs, little insignias of pot leaves on everything. Nug is a marijuana slang, Sour Pot Heads versus Sour Patch Kids, and Doritos. And, hopefully, some of our major manufacturers will start filing lawsuits against these copyright infringements. But right now, the legal market of marijuana is so maverick and so cavalier, really just anything goes out there. So then the same thing is happening with tobacco. We have products. You may have seen this Zen product. It's been pretty popular over the last couple years. It is a snuff-like or dip type product where the nicotine has been taken out of the tobacco plant and it is put into a powder or pod type of product, and it can be inserted in the mouth just like snuff used to be able to. And then we have all of the nicotine vaping systems, and you've probably started to see a lot of these. There's an open system and a closed system. The open system is like those little pins where they unscrew and there are vials of liquid that get poured in, they're rescrewed and vaped. The closed systems have pods or they're disposables. We see all kinds of brands, Blue, Jewel is out there, all kinds of colors, very attractive disposables, attractive shapes. And then if we look at the potency levels in the nicotine products, they're really just continuing to skyrocket. This shows us that a pack of cigarettes that has 20 cigarettes in it has about 20 milligrams of nicotine in that entire pack. So it's kind of a milligram per cigarette. So the Juul pod has about 41 cigarettes worth of nicotine in it. The Puff Bar, another common disposable, has about 50 milligrams of nicotine, and the Soren pod has 90. So that's 90 cigarettes in one pod. Same is true for alcohol. And in fact, when we look at youth drinking, almost all youth are binge drinking when they drink. So they're drinking to get drunk. We see it about 90% of users are drinking in a binge capacity. That means that our young people are experiencing more alcohol poisoning and our marketplace is responding. There are things called alcopops, which are these kind of brightly colored beer can shaped drinks. They're considered binge drinking in a can. They're beer can sized, but they have 4 to 5 beers worth of alcohol in them. And not surprisingly, they have a big underage following. And then we get to just, the monster that is fentanyl that's leading our overdose death epidemic. Products or pills that are, it's becoming laced or replaced in all of our illicit drugs, cocaine, methamphetamine, MDMA, and then also sold through drug dealer channels, but also sold online. And then we have this fake pill market that I'm sure so many of you know about. This picture is becoming, unfortunately, very common, but this is showing us what an oxycodone actual pill looks like versus a fake pill, which is just made of fentanyl. We also have xylazine that is making its way into the illicit drug arena. It is a central nervous system depressant. It comes from the veterinary world. There's no approved use for xylazine in humans. And when it's added, however, to drugs that humans take, in particular opioids, it amplifies that effect. And then it also has those entirely grotesque side effects where you're seeing, I think they call it necrotic skin ulcers, where you've got skin that's being eaten away, and that zombie, I think they call it a zombie drug, where people that take it will be walking, but they'll be bent over and walking. So just absolutely horrific. And both of these are just increasing the chance of fatal poisoning. So with that,
back to me for more data. So I feel like my last data was all very positive. I think this is positive too, in the sense that it gives us information that's really valuable. So again, at IBH, we took big national data, in this case, the National Survey on Drug Use and Health. So that's nationally representative sample of 17,000 youth between the ages of 12 and 17. And when we took that data, we asked a specific question of it. We said, is the use of one substance by adolescents associated with an increased risk of using any other substance, regardless of sequence? So I don't know if that makes sense, but the next slide is going to show you what that means. All right. So this slide, again, I want you to remember, this is big national data, 17,000 youth ages 12 to 17. And here we just divided them into two categories. This first category is the ones who said, I did not use any alcohol in the past month. And then on the other side, we see the ones who said, yes, I did use alcohol in the past month. So that line dividing is dividing the no past month alcohol use from the yes past month alcohol use. And then you're going to see those bars at the bottom. And the bars at the bottom are showing marijuana use, other illicit drugs, and cigarette use. Okay. And so I want you to get used to eyeballing this. And this is what I call big bars, little bars. So in the no past month alcohol use, you see some kind of little bars, which means they were, if they didn't use any alcohol, they were unlikely to use marijuana, other illicit drugs, or cigarettes, nicotine. But if they did use alcohol in the past month, some alcohol, then you see much bigger bars. And then we have more data on alcohol. And as we've been talking about this, unfortunately, this population is very into binge drinking. As a matter of fact, when they drink, they almost always binge drink. And so when you see binge drinking, look at how much that is a big jump up of those much bigger bars, the higher percentage of them. And here we have heavy alcohol use. And heavy alcohol use is just defined as repeated binge drinking. So if you binge drink every weekend, for example, that's heavy alcohol use. And so now just look at what these numbers mean in terms of increases. Look at what this means. So if you have some alcohol use, that's 5.8 times more likely to be using marijuana. But if you're binge drinking, it's 9.9 times more likely to be using marijuana. And if it's heavy alcohol use, it's 15.7 times more likely to be using marijuana than your non-alcohol using 12 to 17-year-olds. And then we could do the same thing for other illicit drugs. Those are like those scary pills that Debbie was just telling us about. You know, a lot of us, that's the thing that really gets our attention, that we're really frightened about. And so, you know, we might say, I'm worried about pills, I'm not worried about alcohol. Well, look, if they're not using alcohol, they're probably not using pills. But if they are using alcohol at each of these different levels, look how much more likely they are to be using these illicit pills. And then the last one is cigarette use or nicotine use. And again, much more likely, if you're using alcohol, much more likely to be using cigarettes. So this slide, new slide, same concept, okay? So it's that same big national group, 17,000 youth ages 12 to 17, but this time we've divided into no past month marijuana use and yes past month marijuana use. Doesn't say anything about quantity, just did they say, no, I did not use any marijuana, or yes, I did use marijuana in the past month. And look at these differences. Again, if they did not use marijuana, little bars on pretty much across the road. But if you go up to yes past marijuana, you've got much bigger bars. And this are really statistically significant, 5.6 times more likely to be using alcohol if they did use marijuana. And then this last, yeah, this is good. This last slide is just looking at that same data, but again, this time dividing it by nicotine or cigarette use. And I don't have to go through the whole thing. You can get it. Little bars, if they didn't use cigarettes, they probably didn't use other things. And if they did use cigarettes, they were much more likely to use other substances. And the reason this is so important is for us to understand that in youth, all substance use is connected. We don't see people who use a single substance. We see people who use multiple substances. So sometimes the parents or the adults in their lives are thinking, oh, I'm not so worried because it's just this or it's just that. And I want you to really keep in mind this data, that it's not just this. It's very likely if they're using one substance, they're going to be using other substances. And this is including vaping. So we did look at this data that it came out on the vaping topic because everybody asked this question. And we thought we wanted to know the answer to this too. And look, we found out the same thing too. Nicotine use, including vaping, is associated with a much greater likelihood of cannabis use and binge drinking. So it completely supports the data that we have. It's all connected. So substance use in youth is connected, but also non-use is connected. So that's where I get in my little punch for the good news here.
So what do we do as parents? And that brings us to number 4 in the One Choice 5, which is talk early and talk often. So prevention, as we all know here, is not a single conversation. It's not one big 60-minute talk. If some people like to say it's 61-minute talks. We talk to our kids over their entire lifespan with us about drugs and alcohol in age-appropriate ways. And some good news about that is that the American Academy of Pediatrics agrees with this. They agree with the non-youth health standard. And in addition to us talking to our kids, we know that our kids trust their doctors and that they're healthcare practitioners to give them real information. Interestingly about that, though, we also find that they're a little bit less comfortable actually talking to those providers, and they're more comfortable talking to us, which is surprising, and of course their friends. Now, as their parents, we can encourage them to talk to their healthcare professionals and let them know that we are, happy for them to do that. But we also need to be excited and embrace the fact that our influence does really matter. If any of you have high schoolers in your life, high schoolers in particular, and or have had them in your life, they may have been like mine, and they were masters at making me think that my input and my advice was not welcome, was not needed, was not useful. But in fact, we see in the data that it really is. Children who know that their parents whose parents have talked to them about the harms and risks of alcohol and drugs are 50% less likely to use, and 80% of young people say that their parents are a leading influence in the decisions they make on whether to drink or not. So let's talk about how to take advantage of that.
80%. So whatever it looks like on the outside, this is a number that I hope that parents and caregivers will take home from tonight. When it feels like they're not listening, they're listening. So use that opportunity, take it, and talk.
Awesome. So
Had to
true.
say.
Yeah, no, it's good.
It's a big number.
So we want to be, preparing our teen. We want to be getting credible information like what you're hearing here and in other places. There's an opportunity to pre-bunk myths. So the brain actually tags new information as true. So if we can get in there first with the more reputable and reliable facts, that's just a good thing. We always want to be in conversations with our kids, asking questions, utilizing all these new effective listening skills and tools that are out there. Motivational interviewing is everywhere, craft. There's all kinds of these things that help us be in communication better with our teenagers. It's not easy. They are difficult. So having a few skills and or having support can always be helpful. Validating their resilient behaviors, playing back evidence of their ability to cope can always be useful. Sometimes we don't even realize we have coping skills that we use to deal with stress, and it always helps to get that feedback. As parents, finding and expressing our why do we want you not to use? There's all kinds of very specific and authentic views that parents have on their specific kids, and each kid can be very different. It may be things like they're unique in the world in a certain way, and you don't want anything derailing that. Or it can be more, macro, like we're not going to be naive about marijuana commercialization. This is not some major social justice movement. This is bottom line profitability. It's tobacco 2.0. But finding your reason why can be really helpful as a parent. And then we always want to help our teens be ready to handle risky situations. That can be code words or pre-planned excuses when they need to leave, practicing refusal skills with them. I've always found that works best with middle school and maybe early high schoolers, older high schoolers, maybe not so much, but still worth a try. And then we always want to remind our kids to always seek help if something's going wrong. If they're in danger, if a friend's in danger, if anything goes suicidal, if there's any kind of mental health crisis in any way, call help, get help. Just so there's no confusion about that. And all of this, we're really prioritizing health and safety. So we want to clarify family expectations of no use. We want to exercise our parental right to know and stay connected with other parents, especially when kids get into high school. Lots of parents are not really sure. There is a whole autonomy component to high school. They are starting to learn to advocate for themselves. That's all very real and developmental, but your right to know where they are and to be connected to them in various ways is also completely appropriate. We always want to lock up medications, THC, and other substances, and monitor alcohol in the house. We don't want to be homes that source alcohol for underage kids for all kinds of reasons. It's illegal. As one, parents take on an incredible amount of liability when they serve other children alcohol or drugs that are not theirs. And most parents don't think about this particular component, but if a parent is serving a child alcohol or drugs, they are taking on the mental health of that child. And I don't think we think about that very often. We certainly want to advise our kids to never get into a vehicle with anyone that is driving who has been using in any way, and that's young people or older people. And we want to share family history. And this is kind of ties to that last point. First of all, addiction can be hereditary. It doesn't have to be. And it doesn't mean everyone who's got it in their history is going to become addicted. But sharing that information can be very valuable for kids. We know lots of kids that use it prophylactically. It can be really hard. Addiction inside a family can be very stressful. It can be completely ignored. It can be completely talked about, and everything in between. But anyway, it's not always that easy. Nonetheless, it can be very prophylactic for our kids, and we always want to support family members that are in recovery. Lastly, from a parenting standpoint, we want to look at what we're modeling. We want to model healthy behaviors, and this can be kind of sticky, right? Because we're adults, we can drink. In certain states, we can use drugs if we want to. So, really, do we have to just stop at all of that? And every family has to answer that for themselves. And every answer is going to be fine. But our behaviors do impact our kids. So we came up with this little check-in that we call the Stress Joy Social Check-in, which just very simply says, look at those moments in your family life that are stressful or joyful or about being social. And do they always involve alcohol and or drugs? And if they do, just add some that don't as a first step, so that your kids start to see a wider variety of behavior and a wider variety of celebrating and handle stress. We can also just start expressing or emoting more openly, walking into the house when we've had a hard day. Oh my God, that was a horrible day. I'm so stressed out. Somebody I deal with dinner. I'm going to go for a walk, come back, report in. How did that go? We're just helping our kids see how emotions can be handled in a wider variety. So that's it from talking. We can answer all kinds of questions at the end. Just a plug for the Talk They Hear You campaign that is produced by SAMHSA. This QR code takes you to their website. Lots of resources, PSAs, conversation starters. They actually have an app you can download on your phone and practice having conversations with your kid on this app. And it has conversation starters. There's also the podcast, which I host, which I think is a great product. And it's just a great place to start.
Awesome. Thanks, Debbie. So now we're sort of bringing it home to the fifth of those five, one choice five ideas for parents. And that is, of course, to act quickly if you suspect substance use. And this goes to thinking about what to do and where to start, right? So the first important thing I think to note is that not all substance use by young people is going to mean that a young person needs treatment, professional treatment. Sometimes intervention by you at home can make a difference and can make a start, right? Having that conversation, noticing and talking in ways where you ask open-ended questions in a non-judgmental way, and talk from a place of concern and a place of health, as opposed to a place of punishment. If you feel like you're going to go to that place where you're going to really lose it, taking a beat, taking a breath, right? If you co-parent, talk to your partner and make a plan together about how you're going to approach, brainstorm what you're going to say, how you're going to say it. As Debbie mentioned, the Talk They Hear You website has a whole host of tools to help with that, and they are locatable either from SAMHSA's website directly on the QR code that we shared, but they're also available right through this section of the One Choice 5. So lots of places to get to that good information. The other thing that's really important to do, if you are starting to be concerned about use, or you suspect that your own child or a young person who you have contact with or who's in your home might be at risk for using substances, you want to, and I'm going to ask you just to go back real quickly, Debbie, you want to evaluate what's in your house and limit access. And that can include things like, as Debbie mentioned, locking up substances. We talk a lot about safe disposal of prescription medications, for example. We know that often the initiation of use of prescription medications happens from medicine cabinets at home, at a friend's house, at home, at grandma's house, at your auntie's house, right? So having things like lock boxes that store medicine safely, evaluating that in your own house and limiting access, and monitoring things that are harder to lock up. And also identifying who your supports are locally for you. That can include, and we encourage you to have it include your child's primary care provider, right? These are great conversations to have with your child's pediatrician. And often now we find that those conversations are creeping into screening at annual visits, for example. I know just the difference between my own 23-year-old son and my 19-year-old son. There were a lot more of those kind of screening questions happening with my 19-year-old right in the doctor's office at the time of an annual checkup. If you do get to a place where you are concerned and you think that additional professional help might be needed, or you think a young person you care about is at risk, these are two great examples. One is from SAMHSA. It's called the Screen for Success. There's a mobile app. And one is the Partnership to End Addictions Substance Use Risk Assessment. These are assessments that are not made for professionals to give. They're made for lay people to give. They're meant for you to use at home. They're very brief. They take generally less than 10 minutes to do, sometimes even as little as 5 to 6. They ask a series of questions that help you assess risk, and they also help you locate local resources based on, again, this is one of those ways that technology is actually wonderful, right? Because it looks at your location and it provides you with resources that are local. I also want to point out that here locally in Westchester County, we also have for drug help, the Family Navigator System and Encompass that are all help screen young people for various types of treatment and help families navigate treatment options here in our county locally. So those are great to know as well. I also encourage you to be aware of, and again, this is, I'm coalition folks, our Know to Prevent family, our coalition folks, know who your coalitions are. If you have a coalition in your community, if you don't, you should know directly in your community, you should know that the Westchester Coalition for Drug and Alcohol Free Youth is an umbrella coalition that helps to serve the county at large. And those are resources that are available to you as well. Last, what if your child is in that number, that growing number, and there is a very good chance that they are, that either have never used at all or are making an active choice right now not to use substances, right? And what I love about that, or what to me is so hopeful about that idea, that we're not just looking at lifetime non-use, we're also looking at past month non-use, because that can represent a decision to do something different than I did yesterday, because maybe I tried something and I realized it wasn't helpful, or it didn't make me feel good, or I'm worried for a friend and I'm convincing them to try to do something different, right? So if we want to, as parents and caring adults, encourage and reward that non-use behavior. When we see it, as Debbie talked about, find those teachable moments, not just to tell your kids when they're doing the thing you don't want them to do, but to acknowledge the moments when they do the things. I'm so proud of you for making that choice. I'm so happy that you made that choice not to, I know you went to that party. I know you left because you were worried about what was going on there. I'm so glad you did, right? Continue talking early, talking often, and reinforcing that message over and over and over in those developmentally appropriate ways. There's a way to talk about prevention with a 5-year-old, right? We don't put things in our body that can possibly hurt us. There are some things that are okay for grown-ups that aren't okay for young people. Those are prevention conversations at the very earliest ages, right? And we just keep building and growing and scaffolding our skills with those conversations as our young people get older. We always want to approach those in an open and non-judgmental way. We ask about their peers. We talked about that before. Talk to them. What's going on with your friends? When you see somebody using a substance on a TV show and your child or your teen notes or laughs about it or says something funny, hey, is that something that you have ever seen people do at school? Is that something that happens? Do you have friends who do that, right? Those are great questions to ask in moments that can come up really organically, that can be part of those 60 or hundreds of 1-minute conversations, right? And to always remember that this is a focus on health. The focus is on health. This is about that brain protection, protecting that developing brain so that our young people have all the opportunities to grow in ways that are positive and healthy, and that keep them as far away from risk for addiction and other negative health outcomes as possible, right? So I'm going to turn it back over, or actually I'm going to share with you a message. I forgot that this was in there, and I'm so happy that it is. Again, as part of that One Choice community, we have some partners in a group called Join Together Northern Nevada, which I learned recently when I was with them at one of their conferences to present, that Nevada is how you say it. Join Together Northern Nevada is one of our One Choice coalitions, and their youth leaders created this PSA for parents and adults. So Debbie, I wonder if you will just click on this, because I love just giving kids the last word.
Dear parents, this is a message for you.
Marijuana and alcohol might be legal, but that doesn't mean they're safe for kids.
But they're natural. Tobacco comes from a plant. Would you want your kids to smoke cigarettes?
If parents don't think drinking or using marijuana is risky, their kids won't either.
Parents, you make all the difference.
Don't be your kid's dealer.
Legal doesn't mean safe.
Together, we can all make healthier choices. Visit jtnn.org for resources and information.
That was so good. I love what you said, Nancy, about letting the kids have the last word. And now I'm going to talk. But I love listening to what the kids
almost
say.
Last word.
Almost last word. And on our website, we have a bunch of other versions of different communities have done things with their kids, and every single one of them will like bring tears to my eyes. No joke. It feels like they say the same thing that I say, but it's so much more powerful when the kids say it. And so I really encourage you to look for what the kids have to say. Just bringing us home here, I wanted to bring up one point about older kids. I have a particular fondness for college age kids myself, and we didn't really talk about that in this. And I wanted to say, if you think about it, these high school seniors, a third of them, or a little more than that, haven't used any substances in their lifetime. And 60% of them haven't used anything in the past month. They're not regular users, and they're going off to college. And so as you're seeing, as we're at the end of this, school year, if you've got kids that are graduating and heading off to college, that can feel like, and now, game's over because everybody uses in college. That can be that gap, that perception gap we've talked about. There's a belief everybody uses that gets perpetuated, but it's not true. That A third of students have never used. They hit college having never used, and it's an active choice. These are kids that have made that choice not to use, and they're actually unlikely to start using in college while they're still underage. And that group that's that 60%, you have a lot to say to them about your expectations about college. So don't kind of give up. Let them know what your expectations are for them at college in terms of drinking, marijuana use, and other substances, so that they go off kind of prepared and having made some decisions for their own health in advance. So I want to just put a little plug in for that. This slide is just reminding us of the importance of having kind of a comprehensive view when you're talking. It's really important to know the science. The developing brain being uniquely vulnerable is something that people really can understand. And brain protection, kids today want to protect their brains. They want to protect their mental health. So this is a powerful information. Understanding the data that for youth, all substance use is connected. Don't get lulled into it's just vaping, it's just this, it's just that. Watch out, because substance use is connected. And if they're using one thing, they're very likely to be using other things. And as new substances keep coming out, they're going to have more things to choose from. So really think about that connectivity. And then think about this great news that there's a growing trend of youth that are not using any substances. It's quite a large group. It's a big minority. Look for them and support them, as Nancy's saying. Give them that positive reinforcement if they're making those choices, and find out what their reasons why are, because they're going to have a good story for you. So thank you so much for taking the time to spend the evening with us. And if you are interested, we would love to hear from you. We really, that community Nancy's talking about is a rich and vibrant one. And so you reach out to one of us. You can go right to our website with this QR code, or you can reach out to one of us with our emails, and we would be thrilled to talk to you and learn what you're doing and see how we can help you in your endeavors to take care of our youth of today and tomorrow. So now I think we're going to have the opportunity to have some questions in a few minutes.
Yes, very much. Thank you very much for joining us and sharing what is something new that I learn every single time. I am going to put up my slides real quick. Before we get into the Q&A, we would appreciate everyone's feedback tonight. You can simply point your camera. We all know how to use QR codes at this point. It's a very, very short survey, but it's very important and does, in fact, guide us in what topics you want to hear about. And we have done from A to Z in terms of presentation. So please access the survey when you can. It will also be emailed to you when we send out the recording of this presentation. And the one question I can answer is yes, you will get the slides in that same email from this presentation. So I can mark that off the list. I don't think I can answer the other ones. So I will look at okay, we had a couple questions come in. First one is, actually, this might be for you, Debbie. It's kind of data related. Are there ways to reduce the binge drinking behavior down from 90% while abstinence is the goal? They're curious about what success is, or what could be successful somewhere in the middle for someone that is using already, or obviously is not of the abstinence mind.
I'm going to let Dr. Caroline take that one. I think it's a brain development problem. We just don't have the breaks when we're adolescents. So it's harder for kids to restrain their use. But
yeah, I mean, Debbie, I think what you're saying is absolutely true. The problem is that it goes with that idea that we like the idea of saying, oh, I'm not really worried about this. If they're just drinking some beer with their friends, that's fine. I did that. That's fine. Or, whatever that is, that's kind of whatever your tolerance as a parent is, sounds okay to you. And so you want to support them in what they're doing. But the reality is that data that we show is that almost all drinking is binge drinking behavior. And so that might not be their intention, but that's very likely to be what happens because that's what's happening in the community around them. And even the types of alcohol that they're drinking are these very high potency alcoholic drinks. And then you also have to think about, again, if they're drinking alcohol, they're very likely to be using other substances as well. And so is a little bit of alcohol okay, and a little bit of marijuana is okay, and I don't know what, a little bit of prescription pills is okay. It's a very slippery slope. And that's why from a health perspective, again, a health perspective, it's really important to be really clear that none of it's safe for that developing brain. And the developing brain really is vulnerable to these things. That doesn't mean that there aren't harm reduction mitigation strategies that you might want to use with someone who's not yet ready to stop using. But there you can see I'm already using the language that's like, are we going to be needing to get some help on helping this person stop their use?
Thank you.
I would add one other thing too, which is when we look at the group of kids that are using, most of them are not using problematically, meaning they're not on that addiction track yet. There's a tremendous amount of choice inside the using population, the agency that they still have that gives them choices about when they're using and why. And I mean, I know this conversation from a parent perspective. It's just hard, especially if you have a kid that is drinking, if you have a kid who's all their friends are drinking, really, they're just supposed to walk away from their entire social structure. I mean, it's so, and the answer is not simple, but having that conversation about why, what is it doing for you? Who are you using with? What else could we do? Is there anything else we could do? Can I help you plan something for a Saturday night? Let's get karaoke. Let's go somewhere. Is there anything we could do? Is there any friend that's not drinking that you guys could kind of team up with this Friday night? And let's see how that works. So anyway, I just wanted to add that context as well.
I think to
I
your
would also add, like from the parent perspective and from working with youth in both our high school and our middle school, and spending a lot of time with youth leaders and hearing them talk about what they think is effective there. Sometimes it's also thinking about what the kinds of motivating things are going to be helpful, right? Maybe the thing that helps a young person think about their own use differently might be to connect it to that mental health piece, or to connect it to some other thing that matters to them, right? Sometimes that can be an effective way to start to at least get an entry point in, is to maybe not focus on the drinking itself, but focus on other things that they care about and the ways in which drinking can make that difficult or be a hindrance to those things. And again, I think to Caroline's point, the biggest one is if a young person is really reluctant to consider non-use, it may be a moment that it's the right time to think about getting some assistance there. That is a moment when some professional assistance may be needed.
To both your points, I think there's a lot of buzz around that term harm reduction these days.
Yep.
And there are, you can be all over the spectrum on that, but I think what we're driving at is, yes, it is very important to meet them where they're at. And if they're at a point of use, that's where we need to meet them. We can't impose expectations. However, we don't want to leave them where we meet them. So that's great that you're meeting them where they're at, but you can't leave them there. So it may be incremental, it may be very fast. Whatever it takes is what we encourage parents from all of our coalitions to do. Thank you very much. Our next question is, are there any studies that indicate that if parents don't use drugs or alcohol to deal with whatever their state may be, are children less likely to develop a problem or an addiction? That's a
I feel like this is that same kind of thing that we have, that we went looking for the non-users. Everybody was looking for the users and we went looking for the non-users. I feel like there's some data that is supporting that the parents, when they do use, when it's all integrated into their social things, and the way we were talking about that stress joy idea for the parents and caregivers to consider themselves. When it's all integrated in and using, and the parents are constantly demonstrating, this is how I handle stress, and this is how I handle celebrations, and this is how I handle everything, that encourages substance use in young people. So one can infer from that when parents are not doing that, that's going to cause a decrease in the likelihood of them using. But I don't know of any specific studies that show that.
Yeah, I think it's important to know there are no for sure. There's no 100% here.
Right.
So when we say likelihood, we mean mathematically the probability, right? So, but it's very powerful. There was a time when I remember laying on the back seat where the tissues were in the car. Nobody wore seatbelts.
Right.
Yes.
Does that
There
mean
weren't even seatbelts in the back seat.
right, exactly. But does that mean that
I might be a little older than you, Lise.
but every car accident does not necessarily relate or result in a death. However, we do know that the probability of that significantly declines when we wear a seatbelt. And so we do. It can be done. We just have to have, like you said, take it from a health approach as opposed to a moral statement on whether to use or not.
Right.
Okay. Outstanding presentation. Love hearing about all of the positive data you shared. I love that, flipping it around and making it more positive than looking for who's doing something that we don't want them to do. Are the studies you cited in some of the slides available publicly on your website?
Everything's available. Everything's available. Go onto our website.
Extra. There's actually more than what you
More.
saw on these slides is available. So when you check out the website, you'll see this and plus. Yes.
Great. Definitely. Could you say the website again for those that didn't write it down? Your website.
So it's onechoiceprevention.org.
Okay. This question has to do with Alcoholics Anonymous. Is it possible to take a teenager to a meeting, or would the meeting attendees find that inappropriate? My grandparents were alcoholics, and they took me to AA meetings when I was 14, and it was profoundly beneficial for me to actually see and hear what can really happen to people with addiction. What are your thoughts on that?
So I love this. I love this idea. I think it's a great idea. And I can see what a powerful experience that would be to have gone to that when you were 14 with your grandparents, particularly. I'm assuming that you yourself are not in recovery. So it would be, both of you would be from outside of the AA community. And so what you want to look for is what's called an open meeting, where anybody can come. And obviously you want to go very respectfully. I think that would be a great thing to do if you had a teen that was interested. I don't think I would necessarily bring along a recalcitrant teen that didn't want to do that.
No kicking and screaming teen.
Yeah, but one that was interested and engaged, and I think particularly with that family history, I think it would be great. And really, frankly, it's very inspiring to go to those meetings. So anybody who's been, I think you always come away feeling inspired.
Great. Okay, this one's particularly apropos for we're in New York right now, and we are a legal state, although one could argue that the regulations surrounding it hasn't been exactly smooth. What do you do if you have a middle schooler and they find out that their adult sibling uses marijuana?
Well, I think what's interesting here, right, is that this could also apply to adult cousin, adult parent, right? Like that, it's sort of the question, like what do you do? Or if they see another parent, a family friend, the adult person around them, and how do you have that conversation? I'm assuming is what they're asking. Is that right? Like, how do you approach that?
So carefully, I think, right?
Well,
Now,
I think
so. What I would say is, I would want to know what my child thought about it, and would want to start the conversation that way. If this is an 18-year-old adult sibling, then I would have that conversation about legality. I would have the conversation about brain development. If I had a problem with it, I would find a way to share that. It makes me so sad that so and so's doing this. Or, you know what? I'm not seeing that there's much of a problem right now, but I am watching very, very closely. Whatever the authentic, honest answer is or conversation is. And I guess middle school, 6th grade versus 8th grade is probably different as well. But I would be really clear about, this is not okay for you. And they're making a different decision than I want for them, and or that I want for you. And that also applies with friends. That's another thing that parents get tripped up in, is when their friends are using, and you can't just go, well, your friend's a bad guy or a loser, because they're probably not. And those kids, and your kid's not going to believe, it's not going to take that and be able to do anything with that. So it's that same kind of conversation. Wow, I wish they weren't making this decision. And if it's a friend, it can even be, what do you think's going on? Why do you think it is? Is it fitting in? Is it just social? Is it stress? You can even do do you want to engage in any way with them and talk to them about not using? And do you want me to talk to their mom? And, maybe a hard no. And if it's a hard no, don't talk to the mom. But sometimes our kids are worried about the people that are using around them, and sometimes they're just curious. So getting clarity on that can be a good starting point.
I wanted to mention that I really agree with you.
Curiosity is a good moment to have a conversation, right?
Yeah.
Right.
I think curiosity is, but sometimes they're going to be afraid. And I was thinking about that I think that it's possible that your middle schooler is like, oh my gosh, I've heard all these scary things, and I'm really frightened for this family member that I love, or this friend that I love. And so talking to them about that is, you're going to help them manage understanding that risk, and also then reinforcing and supporting their good judgment, and their health, their judgments for their health. And I think that it really is a conversational moment that you shouldn't be afraid of asking a lot of questions.
Thank you.
That's why, to Debbie's point, I think asking them what they think about it and how they're feeling is a great place to start, because it really directs you to where to go next. Because if what they're feeling about it is worried, you might start with a different set of information than if what they're feeling about it is curious or something else, right?
And to add on to that, how would you answer the question if it is directed at you? Whether you, for instance, used weed when you were their age? It's a very common question. Did you use?
If you ended up as a raging alcoholic by the time you're 25, you just say, well, it didn't work out real well for me. And if there weren't any problems, I think the conventional wisdom, correct me if I'm wrong, is you don't lie, of course, but you also don't overgrandize and start telling the glory day stories and, oh my God, it was so great, and we were this and we were that. But if there is any downside to your use, tell them that, I wish I hadn't because of these reasons. I think things would have been different in these ways had I not. I'm lucky. There's the statistical luckiness here. I mean, obviously, if 25% of kids that are using under 18 are going to end up addicted, 75% are not, right? So that you can be in that group. And so a way to just kind of make it feel real, versus cagey or weird.
I think it's also really helpful to remind young people, or to sort of reference the fact that to your point, when you were talking about being substance heavy, Debbie, weed, for example, when we were young is not the same. We're not even talking about the same drug anymore. So it's a much riskier, and that's just true. That's just a piece of information that is in a fact. It's a different drug than it was when I was young. I'm lucky that I didn't, I'm lucky I didn't have negative consequences, but this is a different substance. And also, I think helping them understand that part of the choices that we may have made as adults came from less understanding and knowledge than we have today, right? So we're able to change and do things differently because we learn new information that makes us rethink. When I was a young person, my mother let me go out to the beach with my, very Italian dark tanning skin and, put baby oil all over myself. Well, even my very Italian dark tanning skin was still at risk for things like skin cancer. We just didn't know it. As a parent now, I know more things. I never let my children go to the beach and not wear sunscreen, right? We didn't have seatbelts when I was a kid. There literally were not seatbelts in the back seats of cars. My baby sister came home from the hospital in a basket on the car seat. As parents today, we would never, like, the hospital wouldn't even let us bring our child home without a 5-point harness and an appropriate car seat because we learn more information. So some of that is we know more now than we used to know then. And if I were a kid now, I might make different decisions because I know different information and you know different information. And isn't that awesome? Because we can make different choices because we know more, we have more technology and more advancements, right?
Well, I think the technology piece is pretty key because they're digital
They
native.
like technology.
They're digital
It's
native.
really awesome when you can have a technology conversation and not be the technology is evil. We can talk about how technology has given us pictures of the brain that help us understand what happens in the brain that are different. That actually gets you cool points with your kids. So I'm always game for the technology conversation.
Yeah, and just to point out to them that that had we known what we know, what we not only know now because of the technology, like where we are, that it's called evolution. Like we learn things and we go forward. We don't stay in the same place forever and ever. And that has always been true. It was true for us as kids. It's true for our grandparents as kids, and it's true for them as kids. So you do better. And that what we're learning more and more about is that some of this is can be irreversible. So the choices you do make matter. They do matter, and obviously you as a parent can't follow them around 24/7. So you're trusting them to make we trust you to make your own decisions. We just want you to make an informed decision. You know what I mean?
I think that's so important. Ultimately, everybody makes their own decisions. I wanted to put in also something that's really changed over time is that commercialized recreational pharmacology issue Debbie was talking about. The commercialization of this has gotten way more. And I think the kids, they love technology, but they do not love big business. And the idea that big business is making money on their health, they're not fans of that. And so if you tell them follow the money, who's making money off of these, selling you these products and selling you this messaging? They're very savvy once you turn them on to looking for that.
That's absolutely true. Well, we're coming up on 8:30, so I think I'm going to end it now. Thank you again so much, Nancy and Debbie and Caroline, for sharing your knowledge and expertise. Again, I learned something new every single time. So I look forward to seeing you again. And thank you everyone out there for taking the time to join us tonight. And we will be sending out that email within the upcoming week. Be on the lookout and have a great evening. Bye-bye.
Thank you. Bye-bye.